If you're over 70, you've probably been told to keep doing every medical screening, just in case. Annual heart checks, extra scans, preventive imaging, mandatory tests that are presented as essential. But after decades in medicine, cardiac surgeons and geriatric specialists agree on one uncomfortable truth. The older we get, the more important it becomes to avoid certain medical tests when there are no symptoms. Not because the tests are bad. They can save lives in the right situation. But when they are used routinely in seniors who feel fine, they often trigger complications, fear, and risky follow-up procedures that reduce independence instead of protecting it. Most seniors assume that more testing automatically equals better prevention. That was true in your 50s and early 60s, but past 70, the body changes in ways that shift the risk-benefit balance. Healing is slower. Sedation tolerance decreases. Blood vessels are more fragile. The chances of a false alarm increase. And even small findings on a scan can send you into a cascade of further tests that carry very real danger. Here are the 6 tests seniors should never accept automatically. Test 6, routine EKG without symptoms. Routine checkup EKGs are still offered to many seniors as a yearly heart safety scan. The intention is good. The problem is that an EKG in someone with no symptoms rarely predicts a future heart attack or saves a life. Instead, it finds harmless age-related rhythm variations that look abnormal on paper. Those results trigger stress tests, advanced imaging, and sometimes even invasive heart catheter procedures, even though the person never had chest pain, shortness of breath, or reduced stamina with age. The heart's electrical system naturally develops minor conduction changes. They do not always indicate disease, but the printout does not tell the difference between harmless and dangerous. A healthy senior can suddenly become a heart patient overnight. Not because anything is wrong, but because the test picked up something that simply comes with age. The safest approach. If you feel fine, have no cardiac history, and your doctor suggests a routine EKG just to check, you have every right to ask whether that result would change anything in your care. Test 5. Stress tests in people without heart symptoms. Stress tests are valuable when someone experiences chest tightness, jaw or arm discomfort, unexplained shortness of breath, or when major surgery is planned. But seniors are often sent for treadmill or chemical stress tests without any symptoms at all. The goal is reassurance, but the result is often anxiety. Stress imaging in asymptomatic adults after 70 has been shown to produce many false positive results. Once that happens, the next step is often a coronary angiogram. A heart catheter can identify problems when symptoms already exist, but in someone who feels completely well. The procedure introduces unnecessary dangers like bleeding, arrhythmias, and stroke. Physical performance also decreases naturally with age. A senior who tires early on the treadmill may appear abnormal, even if their heart is perfectly healthy. The test result then mislabels a normal age change as disease. If you have no cardiac symptoms, a stress test should never be routine. It should only be used when your doctor is trying to diagnose a real problem you already feel. Test 4. Heart ultrasound without a new reason. Echocardiography is excellent when there are new murmurs, swollen legs, breathlessness, or known heart valve issues. But doing a heart ultrasound yearly, just because someone turned 70 or 75, does not protect heart health. It only opens the door to more interventions. As we age, the heart muscles and valves stiffen slightly. Those changes can appear concerning on an ultrasound image, even if they cause no symptoms and no risk. A cautious doctor might recommend more frequent scans or medications you do not need. The question every senior should ask is simple. Has anything changed? If your breathing, stamina, ankle swelling, and overall function are exactly the same as last year, then a new scan is unlikely to reveal useful information. The safest approach. Reserve heart ultrasounds for situations where something is truly different from before, not for routine reassurance. Test 3. Consumer screening package is promising early detection. Mobile screening companies often visit community centers, offering heart scans. carotid ultrasounds, leg artery tests, and EKGS as one package deal. The marketing targets seniors directly. The language is strong. Prevent a stroke. Mandatory checkups after 60. The fear appeal is emotional, but the medical reasoning is weak. In people with no symptoms, these ultrasounds often detect tiny plaques or narrowings that pose no immediate threat, but once found, they can lead to unnecessary stents, vascular surgery, or repeated radiation scans. Every one of those procedures has consequences: bruising, kidney strain, and sometimes long recoveries that reduce independence for weeks or months. A consumer scan cannot interpret risk in context. It cannot know your medication plan, your lifestyle, or whether the finding has any real meaning. It can only generate an alarming report. That leaves you anxious and pushes you back into the medical system. Test 2. Routine colonoscopies and cancer screenings without individual benefit. Cancer screening saves lives earlier in adulthood, but past 70, the risk-benefit shift becomes dramatic. Polyps that once were dangerous may now grow so slowly that they would never affect quality of life. Meanwhile, the procedure risks increase: dehydration during bowel prep, sedation complications, bleeding, and intestinal tears. The same logic applies to other screening tests, like PSA for prostate cancer or mammography past a certain age. Aggressive treatments for early-stage findings can lead to incontinence, fatigue, infections, and surgeries that reduce independence without extending meaningful life. The key factor is time. A screening test only helps if the cancer it might find would grow fast enough to affect life expectancy. For many seniors with a short to moderate remaining lifespan or multiple chronic illnesses, the risks of surgery and chemotherapy outweigh the potential benefit. Test 1. Whole body scans or lung CTS without high-risk history. These tests are increasingly marketed as peace-of-mind scans. They find everything, and that is the problem. Seniors naturally have benign spots on lungs, kidneys, liver, bones, and arteries. None of them cause symptoms, but when a scan detects them, the follow-up chain begins. Repeat scans, biopsies, additional radiation, steroids, or surgery. Every step is a stress to the body, and in someone over 70, the stress response is less forgiving. A small complication can lead to days in the hospital, weakness, and loss of independence afterward. Lung CT screening is recommended only for individuals with significant past smoking history. For everyone else, the radiation and false alarms create far more harm than good if a scan is offered just to be safe. The safest answer is usually no. The most important message is not to refuse every test. It is to refuse automatic tests that do not consider your body, your history, or your goals. Good medicine after 70 focuses on staying active, strong, mentally engaged, and confident in everyday life, not chasing every potential risk hidden deep inside the body. The decision-making formula is simple. Ask whether the result of a test would change your care in a way that improves how you live right now. Ask whether a positive finding would lead to treatments you would actually want. Ask whether the test helps you feel safer or only makes you worry more. Seniors who take control of these choices are not refusing care. They are choosing the care that protects their independence and well-being. They reduce unnecessary hospital visits. They avoid risky procedures performed only because a test created fear. They focus on stability, mobility, and meaningful time with people they love. Your body has guided you through 70 or more years of living. It deserves thoughtful decisions, focused on protecting your quality of life, not reflexive testing. More testing is not always more safety. Sometimes the wisest path is saying no